This question states, which of the following factors can impact a patient's vital signs? So let's look at the choices. So option A says only age and gender. Now, age and gender are two factors which might impact what your vital signs may look like. However, it's important to note that this choice says the word only here, and age and gender are not the only factors that may influence blood pressure. So we can eliminate option A. Option B states medications, but not underlying medical conditions. And similarly, option B is also incorrect because yes, medications may influence blood pressure. If you're on an antihypertensive, it can make your blood pressure lower. However, look over here and it's saying, but not underlying medical conditions, but not. So you just have to be careful with that part because it could be influenced by underlying medical conditions. So we could eliminate option B as well. Option C states pain perception and emotional state along with environmental factors. And this is correct because being in pain could increase your blood pressure. If you're very emotional, you're upset, that could also influence it. You might hear about white coat syndrome, a person's blood pressure being more elevated when they go to see the doctor, hence the white coat, because they're feeling nervous and that increases it, along with environmental factors. So maybe the temperature outside, if you're vasoconstricting or dilating based on if it's hot or cold out. And all of these are factors that can influence the patient's vital signs. And there's nothing in this choice that states that these are the only factors, because there's a lot of different things that can impact vital signs, including a blood pressure. And this choice has all of these things listed and doesn't signal that these are the only choices. So this is looking like a good option to pick. So we're going to circle option C. But again, let's take a look at option D just to be sure. So option B says solely the time of day. So again, the solely part, so we don't want to go with that because that's not the only indicator of something that could change the blood pressure, so we can eliminate that. So just as an overall test-taking strategy, usually when you see these strong terms like solely or only, that usually is a sign that this might not be the best choice. Always read your choices just in case, but usually there's another answer that's maybe more fitting. And for that reason, the correct choice again is option C, pain perception and emotional state, along with environmental factors, as these are factors which can impact a patient's vital signs.